Welcome to BAGC Health and Wellness Seminar Program. I'm Abhijit Ghosh, coordinator for the program. Our tonight's topic is taking care of your physical health during COVID-19 pandemic. We used to do this kind of educational and informational seminar live at our BAGC Bangabhavan building. Due to COVID-19 pandemic, we are now forced to do it virtually. COVID-19 pandemic presented us with many challenges. We are socially isolated. We cannot physically meet our friends and families. Also, we are unable to do much of the physical activities and exercises as we did before. Those who are working from homes or the senior members who are essentially homebound are experiencing many physical health problems. Our goal for the seminar tonight is to give you some valuable practical information and guidelines that you can use to help deal with these physical discomforts. Once again, our seminar topic tonight is taking care of your physical health during COVID-19 pandemic. We have an outstanding speaker for you tonight. Our speaker is Dr. Abhijit Ghosh. Dr. Ghosh is a practicing orthopedic surgeon in India. He has an MD in medicine and MS or Master of Surgery in Orthopedic Surgery from University of Odisha. He completed his orthopedic residency at Safdarjung Hospital in New Delhi, India. He is a member of the West Bengal Orthopedic Association, Indian Orthopedic Association, and Indian Medical Association. In his daily practice, Abhijit has seen many patients who have experienced this kind of physical health problems, aches, pains, etc., due to this lack of physical activities during COVID-19 pandemic. He will share some practical things that we can do at home to minimize or eliminate some of these physical health issues. On the surgery side, Abhijit specializes in hip replacement surgery. বিজেসি মেম্বার হিপ রিপ্লেসমেন্ট শুনে ঘাবড়ে গেলেন না তো? আরে না না, ও আজকে হিপ রিপ্লেসমেন্টের উপরে কিছু বলবে না আর আপনাদের হিপ রিপ্লেসমেন্টও করতে বলবে না। আজকে আমাদের প্রোগ্রামটা হবে যে এই কোভিড-19 যে আমরা বাড়িতে বন্দি থাকার ফলে যে এক্সারসাইজ করতে পারছি না, তার ফলে আমাদের অনেকের ব্যথা বেদনা, ঘাড়ে ব্যথা, কোমরে ব্যথা, হাতে ব্যথা ইত্যাদি হচ্ছে, সেই সম্বন্ধে প্রিভেনশন কি করে করতে পারি বা যাদের একটু অর্ধেক হয়েছে তাদের কি করে এই ব্যথা বেদনাগুলো টেক কেয়ার করতে পারি, তার কিছু প্র্যাকটিক্যাল এক্সপিরিয়েন্স অভিজিৎ আজকে আমাদের বলবে। So without any further delay, let's start the program. It's my distinct pleasure to invite Dr. Abhijit Ghosh to BAGC. Abhijit, please.
Good evening, Dr. Ghosh. Namaskar to all BAGC members. I'm honored for being invited to this virtual platform of BAGC. Although my topic is related to joints and their well-beings during these turbulent times, but keeping in mind the fact that a major part of the audience isn't from medical background, I'll try to keep my words as simple as possible. I'll try to make them devoid of complicated medical terminologies. যদিও অনেকে বলে বাংলাতে যে একটু বড় বড় কমপ্লিকেটেড কথা বললে you show the higher level of your intellect. Anyway, on a serious note, let's start our topic. Well, patients with comorbidities during these turbulent times of this pandemic, who are in their old age and who are with a compromised immune system, they are at a high risk of mortality. As an orthopedician, the problems I deal with in my daily OPD are related to spine and joints. People usually attend my clinic with spondylosis of the vertebrae or the bone of the spine. What is spondylosis? Spondylosis is a progressive degenerative condition caused by wear and tear of the spine through years. Next, which is very common, is ankylosing spondylitis, which is an autoimmune disorder. What is an autoimmune disorder? It means that our immune system attacks our own healthy tissues. In ankylosing spondylitis, the vertebrae get completely or partially fused, resulting in stiffening of the spine and major joints. In most of the cases, it is the hip joints. Joint disorders and arthritis can be divided in two generalized categories. The most common one, osteoarthritis, which causes degeneration of joint cartilages and underlying bones, and rheumatoid arthritis. It is also an autoimmune disorder, which eventually causes the degeneration of joints, leading to their stiffness. I won't go into elaborate details of these conditions. We will come back to it later on. Well, that's not the topic of a lecture, like elaborating all these degenerative conditions. That's another topic, another lecture. Before starting our topic, let's go through the normal anatomical structure of spine and the knee and the shoulder joints, because our emphasis will be on the disorders of these parts of our body. Here is the shoulder joint. It is made up of two joints. The acromioclavicular joint, where the collarbone and the blade, shoulder blade, they meet. And the next joint, the second joint, is the glenohumeral joint, where the head or humeral head or the ball meets the socket. Now, the rotator cuff, it connects, it is the rotator cuff, it connects the humerus to the scapula and is made up of tendons of 4 muscles. Tendons attach muscles to the bones. Muscles in turn moves bones by pulling on the tendons. The muscles of the rotator cuff keep the humerus tightly in the socket. There is a joint capsule which surrounds the joint. It is a fluid-filled sac that lubricates the joint. It is made up of ligaments. Shoulder injuries can occur to any of these parts. Let's go to the spine. You can see it. The spine can be divided in 3 major parts. The cervical spine, which consists of 7 vertebrae, and it forms the bony foundation of the neck. The thoracic or dorsal spine, which has 12 vertebrae and has 12 pairs of ribs attached to each side of each vertebrae. Then comes the lumbar spine, which has 5 vertebrae or 5 bones. The vertebrae are separated by intervertebral discs. This intervertebral disc has 2 parts. The outer part, which is harder part, it's called the annula, and there is a mushy, soft part, which is called the nucleus. We have heard about disc herniation. It is a very common term. Disc herniation is when this annula ruptures and the soft part, that is the nucleus, spurts out through the broken part. Here we can see a herniated disc. The amount of pain associated with a disc rupture or disc herniation often depends upon the amount of nucleus that breaks through the annulus, and when it compresses a nerve, you can see the nerves coming out. And when a disc ruptures, in most of the cases, it compresses a nerve. And the next joint we'll be focusing on is the knee joint. The knee joint has 3 bones, the femur, the tibia, and it is protected, and they form a hinge joint. And it is protected in the front by the patella, which is the kneecap. The knee joint is cushioned by articular cartilage that covers the ends of the tibia and the femur, and the lateral meniscus and the medial meniscus, they are pads of cartilage that further cushion the joint, acting as shock absorbers between the bones. Ligaments help to stabilize the knee. There are 4 ligaments stabilizing the knee, two on the outer side and two on the inner side, inside the joint. These components of your knee, along with your muscles, work together to manage the stress your knee receives as you walk, run, and jump. We will discuss in a few words the degenerative conditions which we frequently encounter in our daily practice. Osteoarthritis is considered to be the most common type of arthritis and the most prevalent joint disease in adults. Total arthroplasty has been proven to be an exceptional and dependable treatment for end-stage osteoarthritis, with satisfactory clinical outcomes up to 20-year follow-up. The beneficial influence of arthroplasty on symptom management, social life, patient satisfaction, and overall health promotion is indisputable. However, during this pandemic, efforts to delay the spread of the virus and protect the healthcare staff, hospitals have had to stop all non-emergency or all elective surgeries, including arthroplasties. In addition, such major surgeries could increase the risk of complications for aging patients, given that they are at increased risk of severe symptoms. However, delaying elective arthroplasty in patients with severe osteoarthritis may lead to increasing joint pain, less mobility, functional limitations, and increased use of analgesic and steroids. Next, what we encounter most is rheumatoid arthritis, which is also very common. And out of all the rheumatic diseases, a rheumatologist mostly encounters rheumatoid arthritis in his practice. Although I'm not a rheumatologist, but patients in the periphery where I practice, they usually come with symptoms or complaints of multiple joint pain. Further investigations usually confirm the diagnosis of rheumatoid arthritis. Keeping in mind the poor financial conditions of all these patients, I usually treat them so as not to increase the burden of medical expenditure. Anyway, patients with autoimmune diseases like rheumatoid arthritis already have a compromised immune system, which is coupled with the prescribed immunosuppressive agents they take, making them more susceptible to infections. Patients on immunosuppressants may present atypically. For example, patients on steroids may not have high fever. Patients on immunosuppressants may not have a rise in inflammatory markers. Another clinical challenge which may present while treating rheumatoid arthritis patients is the overlap of symptoms which may occur between the flare-up of rheumatoid arthritis and COVID-19 infections. Symptoms like myalgia, that is muscle pain, polyarthralgia, that is multiple joint pain, fever, and elevated inflammatory markers may occur in both the cases. Data from the COVID-19 Global Rheumatology Alliance Physician Registry, which gives information regarding rheumatic diseases and COVID-19, showed that as of on 17th October 2020, the commonest rheumatic disease in which COVID-19 was documented was rheumatoid arthritis. Spondylosis of the vertebrae are mainly treated with non-steroid analgesics and corticosteroids. Gross spondylosis, which eventually lead to nerve compression, requires surgical intervention. Ankylosing spondylitis has no definite cure, but its progress may be checked with hydroxychloroquine and methotrexate, which are also very commonly used to treat rheumatoid arthritis. I'll try to chalk out a general guideline to prevent infection in patients with aforementioned disorders. The first most important thing is control of disease activity. Control of disease activity is of utmost importance in this situation, as studies have shown that high disease activities correlate with increased risk of acquiring infections. Then comes management of comorbidities. Patients with rheumatoid arthritis or old age patients with other disorders have a documented increase in incidence of comorbidities like bronchial asthma, chronic obstructive pulmonary disease, that is COPD, hypertension, cardiovascular diseases, and diabetes. Pre-existing respiratory illnesses, mainly COPD, that is chronic obstructive pulmonary disease, was associated with increased severity of coronavirus infection. Then comes the pharmacological management of these conditions. The first thing which we mostly use are non-steroid anti-inflammatory drugs, that is NSAIDs. They are basically used to control the acute onset of pain in all these conditions. American College of Rheumatology uh, guidelines say that in active arthritis, we can initiate non-steroidal analgesics, but in patients with severe respiratory symptoms with documented or suspected COVID-19 infection, they should be stopped because they may cause respiratory disorders or respiratory distress. Corticosteroids, they are also they are the cornerstone of managing the disease exacerbation and for initial treatment of rheumatoid arthritis and to some extent osteoarthritis. But the disadvantage of corticosteroids is the increased risk of infections, as documented in other observational studies. The Global Rheumatology Alliance, about which I talked earlier, their data shows that out of 1,783 patients with rheumatic diseases who contracted the COVID-19 infection, 33.31% of patients were on steroids. Then comes hydroxychloroquine, which has been shown in several studies to reduce SARS-CoV-2 viral load that is the amount of virus present in your organism, and reduce the duration of viremia. Multiple clinical trials have been conducted using hydroxychloroquine in COVID-19 patients. However, several studies published recently have shown that hydroxychloroquine is not as effective as it was presumed to be and may even cause more harm than good. The use of anti-inflammatory and immunomodulatory therapy in the setting of spine and joint diseases and COVID-19 is basically a double-edged sword. Early and appropriate use of these drugs has been shown to be beneficial in tackling the severity of the disease, but their use in advanced stages is a bit controversial. On the other hand, if used too early, these drugs may even promote viral replication by their immunosuppressive effects, especially when you use corticosteroids. These were the generalized treatment options of joint and spine disorders in the background of COVID-19. The aim of our topic is to provide a guideline for patients with joint diseases. Even though current sanitary measures such as social distancing, washing your hands, using sanitizers, they seem to contribute to a flattening of the curve, but they constitute burdens for patients suffering from severe joint diseases who often cannot come into direct personal contact with their physician or physical therapists responsible for medication prescription or physical therapy sessions. It is against this background that this topic focuses on available home-based non-pharmacological options with the goal of mitigating pain, improving function, and preventing further progression of the disease. So the most important point here is exercise and physical activity. Clinical guidelines, they suggest that exercise is the primary non-pharmacologic treatment of any joint disease, and for that matter, disorders of the spine. The most common types of exercise used for treating knee osteoarthritis are low impact aerobic exercises like walking, resistance training in combination with other range of motion activities. There is sufficient evidence for the favorable effect of exercise on pain reduction and physical function improvement. Exercise benefits patients by inducing muscular hypertrophy, strengthening and increasing blood flow, and joint lubrication. Quadriceps strengthening exercises, strength training of the hip or lower limb, and aerobic training have favorable effects regarding pain and knee function. Spinal extension exercises and swimming have been proven to be beneficial in reducing backaches and providing joint stability. We can use stabilization exercises since osteoarthritis and rheumatoid arthritis, they often lead to instability in the knee due to biomechanical imbalances. I will show you some slides of exercises which may be useful to you. The aforementioned exercises could incorporate progression over time, which has been shown to reduce pain more effectively when compared with non-progressive programs. Running on hard surfaces, jumping, stair climbing, and squatting should be limited. The exercise regimen may be adapted according to the pain experienced and functional limitations. The next important point is diet and weight loss. During the pandemic, patients with joint diseases mostly stay at home. They should therefore pay special attention to their weight. Weight gain, together with decreased strength of surrounding musculature, may increase the load on the joints and spine. There is evidence that for each kg of weight loss, the knee experiences a 4 kg reduction in load per step and a 4,800 kg reduction in compressive load for each kilometer walked. Physical therapy is also very important. A symptomatic patient suffering from severe end-stage knee or hip osteoarthritis or spondylosis may benefit from referral to a physical therapist for video instructions and supervisions. Um, you can also use braces, orthotics, and footwear. Corrective devices, basically they're corrective devices, and they are effective for management of symptoms. Flexible corsets or belts can help relieve lower back pain by applying light pressure to the torso to help adjust posture and shift weight of the spinal column, providing some added spinal support to take pressure off weakened or injured muscles. Knee bracing and foot orthosis may contribute to countering the pain coming from excessive knee adduction during walking. Adduction means when it goes outwards. That has been associated with severe knee osteoarthritis. All these devices, they constitute effective means in the home-based armamentarium to tackle pain and joint diseases. I have made a compilation of exercise videos for joints and spine. I hope you'll find them useful. So here it is. I think it's time to gather all the points we have discussed and come to our conclusion. Under current circumstances established by the pandemic, virtual education on self-management strategies could be part of tackling spine and joint disorders. Initiating an exercise program involving aerobic activity, strengthening of muscles, and improving flexibility is recommended. Obese patients are encouraged to set weight loss goals and adopt healthy nutrition habits. The literature indicates that potential benefits may be gained from the use of corsets, knee braces, sleeves, foot orthosis, and appropriate footwear. Walking aids may be prescribed when considered necessary, but most importantly, it is crucial to take into consideration that none of these treatments may completely substitute the life-changing effect of arthroplasty in patients with severe osteoarthritis or decompressive surgery in patients with spondylosis. That's all from my side. Thank you. I'm ready to take any questions if you have.
Thank you, Abhijit, for very informative presentation. I'm positive our BAGC members will find it beneficial using some of your advices. And I know you are very busy, so thank you for wonderful presentation. Now we'll go to the question answer. We have number of BAGC members who have number of questions. They like to get answers and more information from Abhijit. So সত্যি কথা বলতে কি এই প্যান্ডেমিক আরম্ভ হওয়ার পরে আমার নিজেরই একটু অর্ধেক এই এক্সারসাইজ ল্যাক অফ এক্সারসাইজ রিলেটেড অসুবিধা হচ্ছিল। তো আমি লোভ সামলাতে পারলাম না, তাই প্রথম প্রশ্নটা আমি অভিজিৎকে করছি। অভিজিৎ, আমার বছর 20 আগে এই ডান দিকের শোল্ডারে একটা ফ্রোজেন শোল্ডার হয়েছিল। যে ফ্রোজেন শোল্ডার যাদের হয়েছে তারা জানে যে ইটস ভেরি পেইনফুল। আমারও খুব ব্যথা হয়েছিল। তো তখন ইমিডিয়েটলি অর্থোপেডিক সার্জনের কাছে যাই এবং এক্সটেন্সিভ ফিজিক্যাল থেরাপি করার পরে একদম চলে যায়। I was one of the very lucky one যে 100% সেরে যায়। লাস্ট 20 বছর ধরে আমি হেলথ ক্লাবে রেগুলার এক্সারসাইজে যাই, ইনক্লুডিং এক্সারসাইজ অফ দি শোল্ডার বা হাতের, যেটা ফিজিক্যাল থেরাপিস্ট দেখিয়েছিল। তো লাস্ট 20 বছর কোনো প্রবলেম নেই, কিন্তু লাস্ট 10 মাস অলমোস্ট 1 বছর ফিজিক্যাল থেরাপি করতে যেতে পারছি না, হেলথ ক্লাবে যাই না। ফলে এক্সারসাইজ বাড়িতে খুব সামান্য করা যায়। তার ফলে একটা জিনিস লক্ষ্য করলাম যে মাস 2 আগে আমার ডান দিকের ফ্রোজেন শোল্ডারের ব্যথা একটু একটু ফিরে আসছে। তো আমার প্রশ্ন হচ্ছে যে হেলথ ক্লাবে কবে যেতে পারবো জানি না, তো বাড়িতে বসে কি করা যায় যে এক্সারসাইজ, যেটা তুমি যদি বলো, যেটাতে এই ব্যথা একটু যেটা হয়েছে সেটা চলে যাবে, আর ফার্দার যদি সেটা নাও যায় ফার্দার যাতে অসুবিধা না হয়। তো এই প্রশ্নটা কোইন্সিডেন্টালি একটা সিমিলার প্রশ্ন আমরা পেয়েছি বাসবী গাঙ্গুলির কাছ থেকে। তো আমার মনে হয় যে তুমি আমারটা উত্তর দেওয়ার আগে let me read that question from বাসবী গাঙ্গুলি। উনি আনফরচুনেটলি আজকে জয়েন করতে পারেননি, কিন্তু উনি আমাকে বলেছেন যে কোশ্চেনটা বলতে এবং তোমার কাছ থেকে সাজেশন বা যা অ্যাডভাইস নেওয়ার জন্য। তো আমি বাসবী গাঙ্গুলির কোশ্চেনটা পড়ছি। I had shoulder surgery 10 years ago. The torn muscle rotator cuff, I believe, was repaired with artificial synthetic fiber or something like that. Nowadays, I'm having pain on my shoulder and upper arm muscles from time to time. Is there any remedy for this condition? তো আমার মনে হয় তুমি এই দুটো সিমিলার you might combine and answer.
What is frozen shoulder? It is adhesive capsulitis. I have talked about the capsule that encircles the shoulder. When there is a bit of addition in that capsule, that hinders the complete range of movement in shoulder joint, or in that case, in any of the joints. If it is adhesive capsulitis, তাহলে the most important thing for non-pharmacological management is exercises. আমি যে ভিডিও কম্পিলেশনটা একটু আগে দেখালাম, I hope that will help because it has got all the exercises combined in it. For the second question, that is from Ms. Ganguly, I think she hasn't had any fresh tears, new tears in her tendons or in her ligaments. যদি সেটা না থাকে, then it may be a flare up of bit of adhesive capsulitis, bit of adhesion, which may be post surgery, operational পরে. So if there are no fresh tears or fresh tendon injuries, then shoulder exercises are the only management, non-pharmacological management. So you can go through the shoulder exercises and you can do those. Thank you.
Thank you, Abhijit. আমরা নেক্সট কোশ্চেনটা না কোশ্চেন নাম্বার 2 আমরা পেয়েছি, so we'll go to Devashish Chatterjee. Devashish, your question please.
Dr. Ghosh, thank you very much for your time today. So what I was saying, Ami, I spend kind of significant amount of time in front of computer, laptops every day, 14, 15 hours. Before COVID-19, I used to be a regular kind of into swimming. But obviously, এখন gym team সব বন্ধ, so obviously swim করার opportunity নেই. So I get the shoulder pain at times. So what I do, I take painkillers to feel more comfortable during those days. So is there anything else like I can do? I mean, obviously, I read a lot, spend time on laptops. So what else can I do? I mean, swimming shuru karar age, if there is any suggestion, I'll be appreciate it. So that's my question.
Our first question, it also dealt with shoulder pain. You can follow the exercises I've shown earlier, but one thing should be remembered that pain in your shoulder joint, it can be a referred pain, a radiating pain from the neck. In your case, you work in front of a computer for 10, 12 or 14 hours, as you said. So in this case, in your case, posture is very important because when you have a bad posture while working in your laptop, it may lead to radiating pain from your cervical spine, that is from your neck to your shoulder joints. So first thing is try to bring the center of your laptop monitor to your eye level so as not to strain your neck and shoulders too much. You can, if you are working on a laptop, so you can use those customized laptop stands, which brings your monitor to your eye level. Because when the center of your monitor is at your eye level, then you don't strain, you don't look downwards or you don't look upwards much. So that is very important. And there are, in the video compilation, there are exercises for your neck, there are exercises for your shoulder joints, and there are some very simple office stretches while doing your desktop job. So you can follow those. They are very simple and you can do those.
Okay. Thank you. Thank you very much.
Thank you, Abhijit. Next question came from Nina Palit. So Nina, please go ahead and ask your question.
Hi. I think our question is a little bit of a follow-up to the last question. So if you are sitting and the neck pain, how often should you get up in the middle to, maybe do the stretches? Or at night, I've been doing some stretches on the foam roller before I go to bed, some exercises. So they've helped a lot. How often? So say you're sitting there and then the suggestion you gave, the eye level, is a really good one. I've done that and it's helped a lot. Onekta, my neck pain has become better. So, when you're sitting, and if you want to set a timer for stretching, like, is it every hour and a half? Like, how often should you try to move around and maybe for the neck pain or just any kind of pain?
Thank you for the question. It's very important for people who usually spend a lot of time in front of their computers. Ideally, you should have a break of 5 minutes every hour. Just stand up, take a few quick steps, squat a couple of times. Of course, if your knees allow it, stretch your neck, your shoulders, and your back. The stretching exercises, there are some few office stretches in the video compilation. You can go through those. And there are specific exercises for your neck and spine. In your leisure time, you can follow those exercises. Since you work in front of a computer for such a long period of time, there is a very famous rule that is called 20-20-20 rule, which says that every 20 minutes, you should look up from your screen, try to focus your eyes on an object which is about 20 feet away for about 20 seconds. This helps to relax the muscles of your eyes. Basically, my OPD job, it also involves sitting for long hours. It's also almost a desk job. So I usually stretch my neck whenever I get a chance, sometimes even between patients, like when a patient has left my cabinet and the next one is yet to come in, I stretch my necks. That helps. So that's it. I mean, office stretches, doing a bit of stretching, and try to follow the 20-20 rule. That will help.
Do you think the foam roller helps? Because I use it at night. You know what I'm talking about? That big, the roller with the foam,
Yeah.
and then kind of stretch on it in the evening.
What they do, they basically help relax your muscles, because when you're working, I mean, they're stretched. When you're stretching those muscles, you are straining those muscles. So whenever you use those rollers, yeah, they help. They help relax those muscles. It's basically like going to a massage parlor. You get a massage done, foam rollers, they do it for you.
Thank you.
Thank you, Abhijit. Next কোশ্চেনের জন্য আমরা যাব অলোকা বোসের কাছে। অলোকা, তুমি কোশ্চেন করো অভিজিৎকে।
Thank you, Dr. Ghosh. My question is, somebody with a knee replacement surgery, what is the best exercise? What are the best exercises to do when you can't have outside activity or walking because of COVID and winter?
The
Do at
exercises,
home.
I won't, yeah. Is that all? Okay. Thank you. The exercises, I won't elaborate much because you have the exercises in the video compilation, so you can go through those. But post replacement surgery, knee replacement surgeries, the most important thing to remember is to keep a check on your body weight, because the more you put on weight on your prosthesis, the less years they will survive. So a proper balanced diet is very important. And another important aspect is to have a strong supporting musculature which supports your joint. The exercises I've shown, there are some exercises with a bit of weight. So you can do those to strengthen your musculature, and that will, of course, that will help support your prosthesis. And of course, squatting is a no-no. I hope you have been told that you can't squat. That's it.
But walking and exercise bike is good?
Walking is good. Exercises, well, without squatting or without bending your knee much, they are good. But stair climbing should be avoided as much as possible.
Oh, okay. Thank you.
Thank you, Aloka. Next question came from Dr. Krishna Chakraborty. Unfortunately, Krishna di আজকে join করতে পারেননি, কিন্তু Krishna di gave me permission to read the question and get some feedback from Abhijit. তো আমি Krishna dir কোশ্চেনটা পড়ছি। Because of COVID-19, our social interaction with friends and families are almost non-existent. Also, due to cold weather, I cannot walk around the building where I live. We also cannot shop more often for healthy vegetables, fresh fruits, fresh fish, like we used to do before. This makes us lazy, and we are forced to eat more processed foods. We are not using some of our muscles as often as we used to, and probably not getting enough vitamins like vitamin D from sunshine. So my question to Dr. Ghosh is, number one, are you seeing some diseases more prevalent during the pandemic in your practice? And second part of the question also, if I delay a required spinal surgery, will it make it harder to recover if performed later?
Once again, thank you. Yes, I'm getting a lot of patients with aggravation of pain in joints, which may be because of increased body weight, or maybe because of lack of exercises or outdoor activities. So this is one group of patients. Then another is I'm getting a lot of patients with multiple joint pain who have a history of fever for 3 to 4 days. Apart from getting investigations done to exclude rheumatoid or gouty arthritis, I usually advise antibody tests for COVID-19. And in almost all the cases, the results are positive. So there is prevalence of post-COVID polyarthralgia or multiple joint pain in patients. Yes, I get those. The second question regarding delay in your spinal surgery, you didn't mention which kind of surgery you refer to, whether it's decompression and laminectomy or spinal fusion. Anyway, the success of spinal surgery depends on the stage of compression of nerve roots. So the more the compression, the earlier you need to decompress. That is, the earlier you need the surgery. So if it's your concern, if it is your surgery that has been delayed, I would advise you to get it done as soon as possible.
Thank you. I'll pass that to Krishna Di. I'm sure she will appreciate. For the sake of time, we are going to move. Anybody has any other follow-up question?
I have one.
Okay,
Go ahead.
please.
My question is, when you say stair climbing, what is too much stair climbing? How much is too much stair?
Too much stair climbing, as I tell my patients, like don't climb from first floor to second floor, like say 15, 20 times a day. And like if you climb once or twice a day, it's not that harmful.
Okay.
But usually what we do in India, you get say 2 clothes washed, you go upstairs, you climb downstairs. Again, you get something, I usually say take at least a bucket of clothes, go upstairs and come down and go again and collect those clothes. So that is too much of stair climbing.
Okay, thank you.
My pleasure.
Okay, at this point, if there are no other questions, I'd like to thank Abhijit for taking time from your busy schedule. We really appreciate on behalf of BAGC. I really appreciate and thank you. Also,
I would like to thank you all for giving me this opportunity, and I'm really honored. Thank you all.
Okay. Also, I'd like to thank our technical team, particularly Bhaskar Chakraborty. Without your help, without your technical assistance for recording and broadcasting, it won't be possible. So thank you. At this point, I would like to request our BAGC President, Jayanta Mukherjee, to say a few concluding remarks.
Good evening, everyone. Thank you very much, Dr. Ghosh, for giving us an awesome presentation and answering all the excellent questions asked by our people. And very nice. And it was a really informative and very nice session. And thank you, Deepak Da, for organizing this. And thank you to our technical team. Thank you, everybody.
Thank you.
Good night.
Thank you, Jayanta. আজকে আমাদের সেমিনার এখানে শেষ করছি। I want to sincerely express my appreciation to BAGC members for your active participation. আপনারা দেখতে থাকুন, শুনতে থাকুন. We have number of video seminar program coming. You will be notified at appropriate time with email. So without your participation, there won't be any seminar program. So অশেষ ধন্যবাদ। আর আপনারা সবাই সাবধানে থাকবেন, নিরাপদে থাকবেন এবং সুস্থ থাকবেন। নমস্কার।